Dr. Levy, you say there's only one cause of disease. Not hundreds, not thousands, one. What is it?
Well, there's only one cause of disease, and that's a toxin. And that might seem a little outlandish at first blush, but then you need to first realize the reason a toxin is the only cause of disease is because the only thing that comprises disease is excess oxidation of biomolecules. Biomolecules meaning RNA, DNA, protein, sugars, fats, enzymes, any sort of molecule in the biological system that plays a role in metabolism or metabolic pathways. And when they're oxidized, meaning they've lost electrons, when they're in the oxidized state, they no longer function. So you turn something in your biological system from a functioning part to a non-functioning part. And if you have a large amount of biomolecules, different locations, different concentrations, inactivated, then those metabolic processes are not progressing normally, and that is the disease state. And this is frequently referred to as oxidative stress, which is a good term, increased oxidative stress. The problem is in the literature, even though you see increased oxidative stress associated with any disease, type in the disease name on PubMed, type in the phrase oxidative stress, and you'll see it there for every single disease. But the wrong conclusion is that oxidative stress causes some sort of disease. In other words, it results in something. That's not accurate. The accurate statement is the increased oxidative stress is the disease. Now, having said that, it turns out that when something oxidizes a biomolecule, that is a toxic effect. And even though this might seem crazy, because I'll tell you the reason why in a moment, all toxins cause their damage by oxidation. If a substance or a molecule or any sort of thing that's considered to be a poison does not oxidize a biomolecule, it's not toxic. Unless you know space accumulation, but as far as metabolic interaction, the only thing that allows a molecule to be toxic is for it to take electrons away from biomolecules. Now, and the definition is then important. The definition is that we see so many synonyms in the literature. A toxin is a pro-oxidant, the opposite of an antioxidant, a free radical, a reactive oxygen species, or poison. They really all mean the same thing. They're unstable molecules that need to take electrons away from healthy, normal, reduced biomolecules to become stable themselves. And when they do that, momentarily, they're no longer toxic because they're no longer in a position to take more electrons, but they've reduced the electron pool. That's an important concept too. The more electrons you have freely circulating in a biological system, going to and fro between antioxidants, oxidize, reduce, you generate an electron flow. And for those who are listening to us, an electron flow is also known as a current. The flow of electrons is a current, electrical current. And it's very well established in the literature that the higher electron current inducing a more significant transmembrane voltage, you simply have a healthier cell. I mean, it's basically having an electrical device that's not getting much juice, but getting optimal juice. So the better the electrons flow, the healthier the cell, and the less oxidation and oxidative stress in the cell. Now, I stumbled across this in many ways 30 years ago working with Dr. Hal Huggins, insofar as I became very aware of the power of intravenous vitamin C. And when I researched the literature and saw the work of Dr. Frederick Klenner, the really initial person, he didn't discover vitamin C, Albert St. George did, and he received the Nobel Prize for that. But that's all St. George was. I'm not minimizing it, but he was a researcher, not a clinician. But Klenner took this information and somehow decided that vitamin C was going to be good in large doses for infections and toxins. And anyway, he quickly established that no matter what the poisoning was, no matter what the toxin was, if somebody came in severely impaired, dying, whatever, large doses of intravenous vitamin C would completely neutralize the toxicity, and unless the patient was on literally death's doorstep, bring them back to complete normalcy. And at the time, 30 years ago, I puzzled about this. I said, how can one substance, vitamin C, simple little vitamin C, how can one substance neutralize the ability of thousands upon thousands upon thousands of different toxins to inflict their harm or to kill somebody or to cause a problem? And even though it didn't register quite right at that time, I quickly realized that the only way that can be possible is that all toxins need to have a final common denominator of toxicity. Otherwise, there could be no commonality, and otherwise, vitamin C couldn't do what it does. And quite simply, it is now very clear that that common causality is that all toxins cause abnormal oxidation or electron theft from biomolecules, putting them into a metabolically inert state, okay? And then the next question was, if there's so many different toxins and they cause different clinical syndromes, so how can that be? Well, that's where the individual variability of the toxin comes into play. If it's fat soluble, if it's water soluble, it's a very large molecule, a very small molecule. If it's ionic, if it has a certain physical configuration that allows it to adapt to some molecules versus others, that determines then which molecules does a large dose of a certain toxin cause the most oxidation to. And so the physical characteristics of the toxins determine the anatomical or physical variation in which biomolecules are oxidized. And it's the unique array of biomolecules in concentrations, what metabolic reactions are involved in, that determines what the disease is, if you will, what the impairment of the normal function of the cell is. And that, in a big nutshell, is the reason that the title of the book is The Only Cause of Disease. The only cause of disease are agents that oxidize. And the only agents that oxidize, by definition, are toxins.
Okay, so really high level here. You just summarized. I'm going to give you what I'm hearing.
Okay.
Oxidation is the disease itself.
Excess oxidation.
And
There's always some
excess.
degree of physiological oxidation, yes.
Vitamin C as an antioxidant is going to come into play as part of the treatment here.
Right.
And then depending on what the toxin is, it's going to impact different areas of the body.
Right. And, you know, probably one of the most dramatic examples of this is cyanide, okay? Like in a capital punishment where they're going to kill the prisoner and they drop cyanide into a bucket and it releases cyanide gas, and the gas is inhaled, and literally in a minute or two, because of the route of administration, that cyanide gas paralyzes respiratory enzymes that are needed to metabolize oxygen. So you stop metabolizing oxygen, it's just like somebody strangles you to death and you die. But that same ion, the cyanide ion, is present in some supplements, okay? Vitamin B12 preparations, hydroxycyanide. It's got cyanide in it, okay? I might botch the name there. But that can be taken orally and there's no toxicity, okay? So because you have the oral administration, it has no access via the respiratory system to these enzymes. So that's probably the best demonstration I can think of to show how it's the physical characteristics of a toxin, where it goes, even though the damage being done is the same thing. You're oxidizing a respiratory enzyme or you're oxidizing a different biomolecule.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
The only cause of disease are agents that oxidize, and the only agents that oxidize are toxins. Thousands upon thousands of toxins in air, water, food. Before somebody just pulls their hair out, how can I